Now we're going to look at the concept of survival analysis with censoring. There are generally three reasons why censoring might occur. Sometimes in our study, a subject doesn't experience the event before the study ends. It may happen that a person is lost to follow up during the study period, or even it could be a situation that a person withdraws from the study. You can see here an illustration of no censoring situation in which all subjects experience the event by the end of the study. There are different types of censoring, including right censoring, left censoring, interval censoring, and a mixture of all of these cases. Our focus will be on just right censoring in this video. Let's look at a dataset example of leukemia patients. As you may know, AML is a type of blood cancer. And our research question is whether the standard course of chemotherapy should be extended for additional cycles. So this is the format of AML dataset. We have here three variables. First variable is time, which could be survival time or censoring time. The second is a status variable showing censoring status, 0 if an individual was censored and 1 for otherwise. X is the third variable, which is a categorical one, and it could be yes if a patient was given maintenance chemotherapy. In this example, we are going to examine the association between the length of survival of a patient and whether or not chemo was maintained. To start analyzing, we need to firstly look at the histogram of survival time in this patient. We see that the survival times are highly skewed to the right due to the fact that there is a person who survived much longer than everyone else. In addition, there were quite a few people who survived for fewer than 10 years. This type of skewed distribution is typical when dealing with survival data, and therefore the normality assumption of linear regression is often violated, making it inappropriate to use. In addition to this problem, we also see a problem known as censoring, as we already mentioned, with these survival data. So if you just look at the 5 patients of this data set, you may realize that the third has a status of 0, and this means that the patient was followed for 13 months and after that was lost to follow-up. So we only know that the patient survived at least 13 months, but we have no other information available about the patient's status after that. Okay, let's come back to the question that we're gonna actually answer here. One way to examine whether or not there is an association between chemo maintenance and length of survival is to compare the survival distributions. And this can be done by comparing Kaplan-Meier plots. First, let's plot the survival curve of this patient using these comments in R programming. To use this function, as you know, you must initially install the survival package in your R environment. Running this function, as you can see from here, tells us for the 23 people in the leukemia dataset, 18 people were uncensored, followed for the entire time until occurrence of event. And among these 18 people, there was a median survival time of 27 months. And as we already mentioned, the median is used because of the skewed distribution of data. The 95% confidence interval for the median survival time for these 18 uncensored patients is between 18 to 45. You can see a summary of running survival fit function in R on the leukemia dataset. If you plot the survival as I have done here, we will get a Kaplan-Meier curve for these patients. As you can see from this plot, the y-axis is the proportion of individuals who have survived up until that particular time. A solid black line is showing the survival curve, while the dashed lines illustrate the 95% confidence interval.